Okay. All right. So, Mr. Manabusan, I'm going to come in. We're going to do a quick exam, just a physical assessment, ask you a few questions, and then we'll kind of go from there. Please pardon the mess, and we'll go from there. All right. Can you tell me your name and your date of birth?
Tommy Manabusan, 11/26/1962,
Okay. And how old are you?
57.
Okay. 57. And what do you do, Tommy?
I'm in textile management.
Textile management. Okay. Okay. Very good. All right. And what is your ethnicity, Tommy?
I am a Pacific Islander, more specific, from the island of Guam.
Okay.
Pacific Islanders, what they normally put down.
Pacific Islander. Okay, great. All right. And today is the 18th of October, 2020. Okay. All right. So, just like I said, a few quick questions here. How would you define your current health status? You feel like you're a pretty healthy guy? You feel like you exercise, do things?
Yeah. Good.
Good. You think it's good? Got it. All right. And how about growing up? You said you came from the islands, or the Pacific Islands, Guam, I believe you said.
Mm-hmm.
So what? When did you come here? Like, when did you move to America?
At the age of 14,
14,
in 1976.
1976. Okay. And before then, did you have any childhood illnesses?
None that I can remember.
No. Did you ever have chicken pox or?
I have had the chicken pox.
Chicken pox. Okay. And you had that as a kid, or did you have that as an adult?
A kid.
As a kid. Okay. So chicken pox. Did you ever have like measles?
No.
Rubella, mumps,
No.
scarlet fever, smallpox,
No.
Diphtheria, pertussis, like whooping cough,
No.
nothing like that. Okay, rheumatic fever,
No.
nothing like that. Any sinus infections as a kid, sore throats, anything like that?
None that I remember.
None that you really remember. Okay, great. All right, now moving on, kind of like as an adult, any illnesses or anything that you've been diagnosed with that you know of, long term or short term?
None really. I've never been in a hospital. I do get an annual checkup,
Okay.
so none that I remember.
Okay. And generally, when you do your annual checkup, you're pretty healthy.
Yes, sir.
Okay, good. All right, good. So no histories of anything that you know as far as like any pain when you walk, any like peripheral artery disease, coronary
No.
artery disease, hypertension,
No.
nothing like that. Okay, great, perfect. Okay. Any history of STIs or sexual transmitted infections?
No.
Nothing like that. Okay, good. All right. Any substance abuse?
No.
Okay. Do you drink any alcohol?
I do drink beer.
Okay. Beer. How many beers do you have a day?
Maybe one or two.
One or
but
two.
Not every day.
Not every day. How often would you say you drink?
Mainly on the weekends.
Just the weekends.
Yeah.
Okay. Is there anything that triggers your drinking? You do it to
No,
for
just
just to have one to relax.
Social.
Social. Okay. Great. All right. A few more questions here. Any allergies?
In the spring, I do have allergies from the pollen.
Just seasonal.
Just season.
Okay. And what happens when you're exposed to pollen?
I sneeze a lot. My eyes get watery. My nose get runny.
Okay. So sneezing, runny nose, runny eyes.
Right.
Okay. Now, is there anything else that triggers the allergies? Is it just pollen?
Just pollen.
Okay. Any issues with work with allergies or anything?
No.
Nothing like that. Okay. Any food allergies?
No.
Okay. Great. Okay. And have you ever had? Do you take anything for your allergies?
Over the counter.
Just over the counter stuff. What do you
Yeah.
take normally?
Usually Claritin.
Claritin works pretty well.
Mm-hmm.
Okay, great. You having any trouble this season with allergies?
Back in the spring.
It's mainly just spring.
Right.
Okay, got it. All right. And do you take any medications?
No.
No medications at all.
Mm-mm.
Okay. Do you take anything for pain?
No.
Like over the counter? Take anything for?
If I do, I'll take ibuprofen
Okay.
for muscles.
Okay. And how often do you take that?
Oh, rarely. Maybe 2 tablets a month, maybe.
Okay. So pretty, not very often.
No.
Okay. And that's typically just for muscle pain.
Mm-hmm.
Okay. Good. Do you take any vitamins?
No.
No vitamins. Okay. Supplements?
No.
Herbs?
No.
Okay. Do you do any other alternative therapies? Do you meditate? Do you use acupuncture? Do you do anything like that?
No.
Nothing like that. Okay. make a little note there. Sorry. All right. And have you had any history of any type of injuries at all?
No.
No medical injuries at all. Okay.
Mm-mm.
Great. All right. Even as a child, you can't remember like did you ever like break a bone or?
Well, I did break my nose cartilage.
Okay.
That's about the only thing I've broken.
Okay. When was that?
Gosh, 1996.
About 96.
Mm-hmm.
So it was a while ago.
Mm-hmm.
Have you had any long-term issues with that?
No.
What happened when you broke your nose? Did you get any treatment for it?
Hit with a softball.
Hit with softball. Okay. Did you go to the doctor?
Yes.
Okay.
Emergency room.
Emergency ER. What did they do there?
Actually, nothing at the emergency room.
Uh-huh.
I had to go see a doctor 2 days later, and he reset it.
Okay. So they did no resetting.
Mm-hmm.
Okay. Good. No X-rays or anything.
I'm sure they X-rayed it.
Okay.
Yeah, but I don't.
You just don't remember.
Mm-mm.
That's fine. Okay, no problem. Did you get any medicine for that or anything?
No.
Okay. Doesn't give you any issues now though.
No.
All right. You weren't. You said you've never been hospitalized.
Correct.
Okay. Good. Have you ever had a transfusion of blood, platelets, plasma?
No.
You have not. Okay. All right. Now, how about your immunizations? Do you get immunizations? Are they up to date?
I did when I was a kid.
Okay, you got them as a kid.
Mm-hmm.
Okay. Have you got any since then?
No.
Okay. Do you know what kinds of immunizations you've had?
Whatever was typical to get back when you were in elementary school. I don't remember what those
Okay.
were.
Do you know if you got a hepatitis vaccination?
Yes, I did.
Did you get a hepatitis B, I assume?
Mm-hmm.
Okay. Did you get mumps, measles,
Mm-hmm.
what we call the MMR, mumps, measles, rubella vaccination?
Right, I did.
Okay, got that. Polio vaccination?
I did.
You did get one of those? Okay. And I apologize. I know I'm younger than you, so not everyone gets polio. That they
Oh,
kind
I
of that's been
understand.
phased out. They don't do that
Understand.
anymore. But I want to ask. So polio vaccination. Did you get a smallpox vaccination?
I don't remember that.
Okay. All right. And then as far as that, what about a tetanus shot? Did you have a tetanus shot?
I know I have in the past.
Okay. When was the last tetanus shot that you had? Do you remember?
Gosh. Over 10 years ago.
Or a DTaP or a Tdap?
Yeah, I did it because I'm a first responder at work.
Okay.
I did it going through those just for precaution.
Sure.
But that's been a good 15 years ago.
15 years ago for your last one. So we'll check that out. Okay. So, and what about a PPD?
What is a PPD?
So a lot of times PPD is what's used to place to see if you've ever had tuberculosis. It's just a little shot they do right above the skin, gives you a little blood.
I haven't had that done.
Okay. Do you remember the last time you had that done?
No, I don't.
Okay.
It's been a good while there.
It's been a while. Okay. More than 5-10 years ago.
More than 5.
Okay. Good. Okay. Okay. And you've never tested positive for that?
Correct.
Okay.
None.
All right. And then as far as screenings, you say you get yearly checkups. You know, we're not due for a prostate exam. We're not going to do that here. But just make sure you're doing that. So as far as screenings are concerned, do you self-examine for testicular?
No, I don't.
Okay. So it's always an important thing to do. Really, it's from really your 20s and up. It's something I
Okay.
have to do. Best time to do it outside the shower, and you can always just grab the testicle with one hand, and you're just feeling for any lumps, tenderness, masses.
Okay.
Okay. And honestly, it should feel firm but kind of rubbery.
Okay.
Okay. And if, of course, if you find anything, get any concerns, always call the office, and they can get an appointment
Okay.
with you. Okay. Have you ever been diagnosed with any psychiatric conditions?
No,
No psychiatric conditions at all.
none.
All right. So you know, no anxiety. You feel like your anxiety is pretty good.
Right.
How's your stress level?
Good.
Good.
Mm-hmm.
Good.
Mm.
All right. So as far as family history is concerned, I'm sorry, I'm actually not in the video. I thought they scoot in a little bit. You're fine. I was me. So family history. Any family history that I need to be aware of? Any major illnesses? Health concerns?
My father passed away at the age of 32, drowning.
Okay.
My mother passed away at the age of 60 with breast cancer.
Okay. Okay. you have any siblings?
I have a brother that passed away at the age of 52 with lung cancer. He was a smoker.
Smoker. Okay. And any other family?
I've got another sister that has had breast cancer, and she's in remission.
In remission. That's good. I'm glad to hear that.
Mhm.
So how many brothers and sisters do you have?
9 sisters and 2 brothers.
And minus the one brother that passed away to lung cancer, all the rest are living?
Yes.
Yes. Okay. Any other big illnesses or anything?
Mm.
Any other histories of cancer or any kind of cancer?
Yeah. No.
Okay. How about any history of hypertension, strokes, heart
My
attacks?
father's father died of a heart attack.
Okay. So paternal grandfather?
Mhm.
Okay. Okay. What about paternal grandmother? Still living? Was she passed away?
No, she passed away at old age.
Old age. Okay.
Yeah.
About how old?
82.
52. Okay. What about maternal grandfather?
I'm not sure how he passed away.
Okay. And maternal grandmother?
I remember her hearing she had some type of a disease, but I can't remember what that is.
Okay. Do you know what kind of disease it was? Was it like cardiac, respiratory, stomach?
No,
No, you just don't
it
remember?
wasn't.
Okay. All right. So any other history as far as like diabetes, any history of Alzheimer's in the family, dementia?
None that
None
I
of that
know
kind. Any history of allergies, asthma?
of. No,
All right. Any neurological conditions, Huntington's, multiple sclerosis?
none.
Nothing like that. Okay. Anemia, thyroid issues?
No,
Any history of mental illness?
no.
Okay. All right. Any known genetic defects that you guys have? Cystic fibrosis, Tay-Sachs, anything like that?
None
None that you
I'm
know
aware
of.
of.
Okay. Polycystic kidney disease, nothing like that.
Mm-mm.
And we talked about deaths already. And then we've talked about ethnicity already. So let's look into just kind of your social history. We've kind of touched on this already. You said that you're a social drinker.
Mhm.
You do work as a textile manager.
Mhm.
And let's see here. Marital status.
Single,
Single.
divorce for. I'm sorry. My late wife passed away.
Yes, sir.
I'm a widower.
Yes, sir. Again, I'm sorry to hear that.
Okay.
Current family?
2 sons.
2 sons. Okay. They pretty healthy?
Yes.
Good. Good. And what's your highest education level?
12th grade.
Okay. And you finished high school?
Yes.
Completely? Okay, good. All right. And how would you describe your current family status?
Good.
Good? Okay. All right. And when it comes to work, how do you feel about your work? You proud of what you do? You like what you do?
I do. I've been in textile for 36 years.
36 years. Wow, that's a long time.
Mm-hmm.
All right. And you said you're a manager there?
Right.
Okay. Yeah, were you hired on as a manager, or you just
No,
worked
I
your way up?
worked my way up.
Very cool. Where'd you start off at?
As a machine operator.
Machine operator. Now, when you were a machine operator, even now, are there any hazards that you may have been exposed to? Chemicals, dyes, anything that may have
No.
been type of hazardous? Okay.
No,
Nothing that you've heard of, at least?
none.
Okay. Okay. And what's your current living situation?
I guess I'm not sure of the question.
So do you live in a house, in an apartment? Do you...
I live with my fiance
With your fiance. Very good. Okay.
in a house.
In a house. Right. Okay. So, and it's a multi-level house, single family house?
Multi-level.
Multi-level, single family, multi-family?
Yeah. Multi-family.
Multi-family, okay. All right. And then as far as, so does the home have, you feel like has all the needs you need? It has a place for you guys to cook, you know, your
Yes.
heating, all that cooling, great. All right. Any pets?
Oh yes.
How many pets?
3.
3 pets.
3 dogs.
3 dogs. Very good. Okay. Do you have a hard time going up the stairs at all? You said it's a
No.
multi-level house? No? Okay, good. All right. And then as far as safety's concerned for the home itself, do you guys have fire alarms? Are those all in the house?
Yes,
All
we
that's
do.
good. Good. Okay. Smoke alarms, carbon monoxide, all that kind of stuff.
Mm-hmm.
Good. All right. Socioeconomic wise, just quick things. Do you have health insurance?
I do.
You do. You have it through your job, or do you have that through another company? Or?
Job.
Through your job. Okay. Good. All right. And do you feel like it's enough for you to be able to get what you need? You can
Yes.
get the type of visits you need.
Mhm.
Do you like dental coverage?
I do.
Vision coverage, if you
I
need
do.
to get those kind of things. Okay, good. And then as far as prescriptions are concerned, do you have a place, a pharmacy you like to go to?
Yes.
Okay, what pharmacy is that?
Family Physicians
Family Physicians.
Pharmacy.
Good. Okay. All right. And you feel like you can afford any medicines that you've been prescribed?
Yes.
Good, good, good. Pause it real quick. Okay, good. All right. So last question I asked you was kind of regarding your health insurance and all that. So do you have transportation? You have a
I
car?
do.
You have a car. Okay. All right. So how about your diet? What do you normally eat?
Whatever I want.
Whatever you want. Never have any
Yeah,
issues?
I don't have an issue.
Okay.
I don't have any allergies.
No, like, you ever worried about gaining weight, losing weight?
No.
Okay.
No.
Okay. What do you do to stay active?
Uh,
Do you stay active?
well, I work. I walk a lot on my
Okay.
job.
Okay.
I walk a lot in the plant. And socially, my fiance and I, we shag,
Oh, cool. Like
dance.
dancing, yeah.
Mhm.
Yeah. I mean, it was a joke, I know.
Oh, okay.
Yeah. All right, so that's good. That keeps you pretty active.
It is.
Good. You guys compete, or you guys just do it for
We
fun?
do. We compete.
Oh, fun. Win anything?
Yeah, we have. We've been lucky.
Yeah. Well, congratulations.
Thank you.
So how often do you guys go dancing, or how often are you walking?
Well, before all this pandemic, before March, we went probably 2 or 3 times a week.
2 or 3 times a week, and how long did that last for? Like, how long did you guys dance for?
Well,
Like at a time, if you're out there dancing.
The typical song lasts about 3 minutes.
Uh-huh.
So we're doing that, and whenever we are on the floor with each other or somebody else, we'll dance. So typically 2 songs, I would say, probably 7 minutes
Okay.
at a time.
At a
We're
time, and
dancing.
that's it. Just 7 minutes, then you go home, or
No. We'll take a break. We'll socialize, and then we'll dance some more.
okay. And how many hours of sleep do you normally get?
6.
Okay. You feel like that's enough for you?
Yes.
Okay. All right. So, so you said you get about 6 hours of sleep a night.
Right.
You feel like you're rested with that?
Yeah, that's plenty.
That's plenty for you. All right, good. And you feel like you have a pretty set schedule when you go to bed, when you wake up in the morning.
I do.
Good. Okay. All right. And then as far as sexual history goes, we can answer these questions if you want, or you don't have to answer them. It's completely up to you. How many partners are you sexually active?
Yes.
Okay. And how many partners do you?
Just one.
Just one partner. Okay. Just your fiance,
Mhm.
or okay. I shouldn't make that assumption. I apologize. It's not my
Okay.
job to do that. All right. Do you guys use contraceptives?
No.
No contraceptives. Okay.
Uh-uh.
Plan on having another kid anytime soon?
No.
No.
Hopefully
okay.
not.
Hopefully not.
I've had a vasectomy.
Okay. So you've had a vasectomy.
Mhm.
Okay. Okay. Has your partner had anything done? Has she
Yes, she's had a hysterectomy.
hysterectomy as well?
Partial hysterectomy.
Partial hysterectomy. Okay. Great. All right. So as far as drug and alcohol use are concerned, we were talking about your drinking a little bit. Do you smoke at all?
No.
Do you do any illicit drugs?
No.
Nothing like that. Okay. Have you ever done drugs before?
No.
No drugs before. Okay. Good. Okay. Okay. And are you comfortable with the amount that you drink?
Yes.
Okay. Do you feel like you need to drink more sometimes?
No.
No. Really?
Hmm.
I mean, I'm going to be honest with you. I've met your fiance. I know. I wouldn't blame you if you felt the need to drink a little bit more. I'm just throwing it out there. No. All right, I'm sorry. So as far as social support, you feel like you've got a good social network?
I do.
Friends,
I do.
family?
Oh, yes.
Good. And you feel like those people will be able to take care of you if something happened?
Yes.
Good.
If my fiance doesn't, my sister's supposed to step in.
Yeah, that's good. I'm glad someone will step in for you. All right. And then we talked about stress. You said you don't generally get too stressed.
I don't.
Okay. How do you handle stress when you do get stressed?
I just I deal with it, and then I don't let it. I guess I just don't let it fester.
Don't let it fester. Okay. All right. Any issues with anger or coping with anything as it comes up?
No.
And I'm sorry, you mentioned that your wife had passed. When did your wife pass?
8 years ago.
8 years ago. Okay.
Mm-hmm.
And is that something that you still? How do you cope with that still? Or is that something you still find?
No, it's something that's happened,
Mm-hmm.
but I've moved on.
You've moved on.
Yeah.
Sure. Okay.
Yeah.
No problem. All right. And then, what do you do for recreation? I know you said you shag. Is that kind of like your big thing?
That's about it.
Okay. Now, before the pandemic and the outbreak, we couldn't get out. We couldn't do anything. What did you do? Did you go out places to shag? Did you mainly go to
We
one
did.
place?
We usually went to 2 or 3 different places
Mhm.
that we typically go to and socialize and shag.
Okay. And were you active in church at all, or any other type
No.
of organization?
No.
Nothing. Really. Okay. And then, how about travel? Do any traveling?
Just to shag events.
Just the shag events. Okay.
Mhm.
Are those pretty local typically? Are they far away?
I guess typical would be going to the beach.
Going
4
to the
hours
beach,
to the
okay.
beach.
Okay. And then, have you been back to Guam lately, or
No.
no? Haven't been to Guam lately.
No.
When was the last time you were in Guam?
2009.
2009. So 11 years ago.
Mhm.
Okay. And then any type of cultural belief or practices that you want to divulge, anything like that.
I do like spicy foods.
You like
I
spicy
eat
food?
a lot of pepper.
Okay. And does it upset your stomach at all? You have any issues with
No.
intestinal? Any like reflux issues?
No.
Nothing like that. No. You get like any indigestion or chest pain or sore throat sometimes when you're laying down?
No.
Nothing like that. Okay. Good. Were you ever in the military?
No.
All right, perfect. All right, cool. All right, thank you so much. So what we're going to do is I'm going to do a quick physical assessment on you. Hopefully it'll be quicker than all these questions. I know it's a long time. Appreciate your time. So I'm going to pause this video and we're going to go someplace where we can actually get all that done.
Okay.